Fuck. Okay. Hey y'all. Doesn't look like anybody is on yet. So let me finish getting my shit together, y'all. Oh my goodness. Um, so I decided to do this live super last minute. So I don't know how many people are gonna join. Hey, the 33. But I'm not all about just sitting up here complaining about, oh, nobody's talking about this, nobody's talking about that, when I can talk about it. So um I know we're on day 2 of people responding to the Bluetooth bullshit. And I have thoughts. I definitely have thoughts on that. But I want to focus more so on just this historic day, this monumental day. Vice President Kamala Harris's inaugural um, White House Maternal Day of Action. It's a huge, huge deal. Um, and so I wanted to make sure I didn't want to have to try to figure out how to fit this in 2 minutes or do a thread or anything like that. So I was like, well, let me just go through it because there are so many details. And I want you guys to actually help me out because I didn't watch the whole day. I'm not going to sit here and lie. Like, I watched the whole day and I might miss some things. And so this is going to be interactive. If you have anything that stood out to you in terms of, a particular speaker or a particular provision that was announced today or a particular conversation, then I want you to join in. This is going to be a substantive discussion. So I do want to talk about that, but okay, before I get into all that, because y'all gonna be mad at me if I don't talk about this Bluetooth shit, let me talk about that. I'm just gonna get it started off. I'm gonna get it started off spicy. Here's the thing. I know everybody has been getting a kiki out of it, and people have been making jokes about it. And of course it's a joke, right? It's fucking ridiculous that Vice President Kamala Harris would get attacked over because she wears wired headphones other than Bluetooth. I have a wired headphone on right now. Okay, wired headphone. Like, get a fucking life. But the reason why I wanted to talk about it wasn't so much to like defend her, because I think we all understand that it's fucking ridiculous and stupid. But I really want to point out just the insidiousness of it. It's petty, but it's also incredibly insidious, particularly because when you think about the language that is used, the language is really damaging. And what the language does in terms of painting her a certain way, that's really more so the point. Not so much that, people are not so much that people are convincing. We're not concerned that people are convincing people to hate Kamala because she doesn't wear Bluetooth, but it's the manner in which they describe her. So I'm going to go to the article. I hate to give it clicks because that's really the whole point, is to write something super fucking inflammatory, have everybody click on it. And then that way, they get more profit. It's a profit motivation. But there are some things that I really have an issue with. Number one, the way that they describe things, like they say that she's wary of the AirPods. Wary. That's a weird way of characterizing it. They characterize her using it as, they said, Doug Emhoff, by contrast, had no such anxieties. It's not anxiety that's driving Vice President Kamala Harris to not use Bluetooth. It's actual legitimate cybersecurity protocol and concern. She's the fucking Vice President of the United States. Anybody that's worked in a classified setting, these people are DC writers, so they know damn well that there are many buildings you cannot even walk in with the Bluetooth, even on your phone, Bluetooth headphones, a watch that has Bluetooth. This is not a revelation to them. So they're being disingenuous with the whole premise because they know fucking good and damn well that a high-ranking official is not going to be walking around with AirPods in their head. But they call Doug Emhoff, and I love Doug, saying he doesn't have such anxieties. Well, Kamala Harris doesn't have anxieties about it either. It's actually well-founded concerns. It's not, concern and anxieties are two different things. But they also say that some aides have described it as a bit paranoid. This is the problem I have. This is why I don't put any credence on any of these punk ass, bitch ass, sorry ass, sour grape motherfuckers who be sitting up there talking to Politico, Shitpolitico, NBC, all these motherfuckers that want to sit there and run their mouth in the media, is because they're actually fucking assholes and they need to stay the fuck out of her business. There's no reason for anybody who has even ever worked for Kamala to even comment on this article. There should be a no comment. What are you talking about? Why are you even asking me this stupid ass shit? But there's absolutely nothing paranoid about it. Again, this is basic cybersecurity measures that she's taken. So even using, like, even quoting, and this is how they try to be funny. They quote somebody else as, oh, people are saying that she's paranoid. No, that's what you're trying to say. And you're trying to paint her as irrational, as being overwhelmed. That's where anxiety comes from. Anxiety is tied to being overwhelmed with something, being incapable of handling it. You know, those are the kinds of ways that they are, you know, trying to characterize her. What was another one I had a problem with? Just it, and to me, this whole still someone who travels with a nuclear football should they be spending time on telling her headphone wires? The American people deserve answer. It's flippant, and you know this is one of the things that the white media hates about her, is that how flippant she is. Oh, she was flippant when she talked to Lester Holt, but this is how flippant they're being about this completely fucking stupid non-story. Nobody cares about Kamala Harris wearing Bluetooth. Like, literally nobody has even made a comment. And if she was only wearing AirPods, these podcast bitches would be sitting up there writing hit pieces about how she's endangering fucking national security with her AirPods. So it's bullshit. But you know, Simone's response was, we had better shit to do. And turns out they did. I'm gonna get to some of the comments. The 33 says, headphone is such a weird article. I read it, kept looking for the me. There was no there. There's never no there. There really isn't. It's just, what kind of random fucking stupid grievance do I have with Vice President Kamala Harris today? Let me brain fart it out on a fucking article and call it news. That's really what we're seeing on a day-to-day basis. And Robin, yes, headphones are safer. Nothing is 100% safe, but a headphone is safer in terms of a wired headphone as opposed to Bluetooth. Jermaine says, I'm focusing on the word some. Man up with the name. Exactly. And Robin says they're trying to Hillary her. Yes. But I think the thing that I just want to really highlight is, even though this has been mocked, even though it's been, you know, basically debunked in terms of the whole premise, I think we have to be very vigilant in pushing back on the language that's used to describe Vice President Kamala Harris. Even the articles, I went back and reread some articles about Trump and his refusal to take these proper OPSEC measures in terms of him using his personal phone and tweeting on the same phone he's conducting state business on and things like that. And they didn't call him reckless. They didn't call him, you know, any other adjectives, derogatory adjectives. They just reported the story. And with Vice President Kamala Harris, these people feel more emboldened to editorialize and really try to paint her and get this narrative going. So, you know, it's otherizing her. It's making her, you know, just seem ridiculous when in fact the story is ridiculous. But the whole thing I really want to draw attention to is when Simone Sanders said we were busy doing other shit, she was right. Because today, which is the real main, the main star of this, they were actually putting on the inaugural White House Maternal Day of Action. This is Vice President Kamala Harris's brainchild. I tweeted earlier today a little bit of a primer on the history of Vice President Kamala Harris. This is something that she has been a real champion on since her days in the Senate, and she was consistently a champion on this. She was the first she introduced the first ever Black maternal mortality bill. And if you look up the words Black and mother in a bill, you will not find one before Vice President Kamala Harris got to the Senate. Okay, the first ever. And on the House of Representatives side, Congresswoman Alma Adams co-sponsored it there. But it's really, really, really important to note that Kamala Harris was the first person to bring this issue to the Senate, specifically tackling Black maternal mortality. Had to give a shout out to Senator Kristen Gillibrand. She was a champion on this as well. Even Senator Cory Booker had a maternal bill. There were several maternal health bills in the Senate, but now Vice President Kamala Harris, then Senator Kamala Harris, was the first to specifically tackle Black maternal mortality, and that bill was called the Maternal Care Act. Okay, then you also had Vice President Kamala Harris being the first to sponsor the Black maternal Health Awareness Week, which was the first of its kind. Well, Congresswoman Alma Adams also co-sponsored that. This was in 2018. Yeah, 2018. And so that was the first time it was recognized in Congress. So that was the inaugural one. Now they kept it going. Different people are co-sponsoring it. But Vice President Kamala Harris was the first person to bring that to the United States Senate, which made it bicameral at that point. And so I want to just highlight that. Also, she reintroduced it in the Senate when you have to reintroduce legislation if it doesn't pass in that particular session. There are parts of her Maternal Care Act that was incorporated into different bills. There's a whole complicated thing with that. But 2018 was the inaugural Black Maternal Health Week. It's still going. Then in the Congress, once Congresswoman Underwood got into the Congress, she, along with Alma Adams in the Congress, and then Vice President, then Senator Kamala Harris in the Senate, introduced the Momnibus Act. Okay, and so Congresswoman Lauren Underwood has been a rock star on this. Her and Alma Adams together have just really been exceptional in their advocacy for particularly Black maternal mortality, but also for maternal health in general. And so I was really happy to see Lauren Underwood really get a starring role. One of her bills passed, it's already signed into law, was the Protecting Moms Who Serve Act. That was passed into law, signed by President Biden last week. And so I say all this to say that this is building upon years and years of advocacy. Today is building on years and years of advocacy, right? Also, in April, Vice President Kamala Harris marked the first ever White House Maternal Health Day. I'm missing one. Okay. The White House issued its first ever proclamation on Black maternal health. And so she actually hosted a roundtable in the White House. That was the first time that had ever happened, right? And so this is a continuation of the advocacy. Now, I've been particularly interested in this subject. I'm a Black woman. Obviously, I was a woman who wanted to have kids. Now I actually have a child, a beautiful baby girl. Y'all know her, Boss Baby ABC, Ava. And so this is something that I've always been very much engaged in when it comes to Vice President Kamala Harris, is her advocacy in this topic. And y'all know me, if y'all follow me in the beginning days, y'all know I was irate when this topic had been Columbus. I ain't gonna say names because I'm not bitter, but when this topic had been Columbus by other people, and I saw all these particularly Black women who just jumped on the bandwagon of another candidate because they gave a nice little answer in a Q&A, like she's the Harriet Tubman of Black maternal health. And I'm like, wait a minute, hold up. Kamala Harris has been working on this for years, and that was a game changer. And I feel seen thanks to this person. And I'm like, well, wait a minute, what about the Black lady over here who's been working on this shit for years? Y'all ain't noticed? So now I'm interested to see today if all the people who were so impressed by She the People Forum or a PDF will be equally as engaged, or even 10% as engaged in what happened today. A couple of comments. Beck says VP Harris needs a better communications team, a very Reese, Roland Martin-ish team. I think that there's a communications challenge just because of the landscape that we're in, but I'm always for more communication. Anyway, let's see. Roddy for Life says it's about compounding their messages to wear the public down. They think it plays well to her competency. Yeah, one of the things that are against her competency, one of the things that they're always trying to paint Vice President Kamala Harris is that she's incompetent, she's like an airhead, she's a bimbo, and all this other shit, which is all completely fucking ridiculous, because I have an encyclopedia of receipts on her advocacy, and she has so much range to talk about such a variety of topics. And if you watched her opening speech today at her opening address at the White House Maternal Health Day of Action, you would see she knows her shit. And anytime you've ever heard her talk about it, she knows her shit. All right. So let's see. Oh, Jermaine asked, think it would be appropriate for her team to discredit the hit pieces, or are they taking directives from VP Harris? It seems to me that Vice President has kind of had a more hands-off approach to addressing hit pieces. That wouldn't be my approach. I personally am a strong believer in you let no slight go unanswered. Even just think about it at work, right? If somebody says something to you, like in an email, right, and they copy all, and you don't respond, then whatever they said looks like truth, right? Like if somebody wrote an email to everybody, CC your boss, the whole team, talking about, oh, you were supposed to give me this, and what you gave me was wrong, and what the one this and the other, and you just ignore it. What happened? Everybody thinking like this dumbass motherfucking incompetent bitch don't get shit don't get shit on time. And when she does get it, it's wrong, right? That's what they gonna think. So me, I would be like, hold on. First of all, I got it to you at this time. Here's the receipt. Boop boop timestamp. Also, it's actually not wrong. If you look here, we're wrong, but here's where you got it wrong. Blah 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 blah. Boom, settle. Now what? Now everybody looking at that person like you're a fucking asshole for trying to put her on blast and you didn't even have your facts straight. So that's my attitude. Don't let slights go unturned. If you leave stuff out there lingering unanswered, it has a compounding effect. Somebody said earlier, compounding effect. So I would never let an article go out that doesn't have an answer. You don't have to necessarily entertain the premise of it, but I would at least be like, this is stupid. This is absurd. Give the Kellyanne comic. She was real good for dragging a motherfucker and being like, this is stupid. I can't believe you guys are focused on this, blah, 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 blah. Right? Anyway, Darian says, I need to be educated. Okay, yes, great. So let's talk about a few things. So number one, this was an entire day. There were a lot of speakers. If you guys did actually tune in, please post whatever your highlights were. But there were a lot of good speakers. Congresswoman Lauren Underwood spoke. I know she's a favorite. She's a huge favorite of mine. And then you had Secretary Marsha Fudge, Ambassador Domestic Policy Advisor Susan Rice gave closing remarks. Vice President Kamala Harris had a one-on-one conversation with Allison Felix. You also had Secretary Becerra who gave remarks. There were a lot of Serena Williams' husband, Alex Ohanian. He gave some remarks. Chiquita Brooks LaShore, she gave remarks. There was a lot of remarks throughout the day. But I want to go to actually some of the outputs of it. If you aren't aware, though, of some basic facts, and I'm not saying that to be demeaning or anything like that. Let me see. Come on. This website is not that great to try and navigate through. Sorry. I thought it was going to be easier to get to this stuff. The briefing room. There we go. Okay. Here we go. Fact sheet. Nope, that's not it. Okay. Boom. So, let me just give you some background. Now, the United States has the highest maternal mortality for developed nations, right? It's ridiculous. And then when you break it down with the racial disparities, you have Black women that are 3 times more likely to die in childbirth. Native American women are 2 times more likely to die in childbirth. And as Vice President Kamala Harris stated today, in rural America, women are 60% more likely to experience complications because they have maternal deserts, right? Maternal health deserts. And so one of the other things that I really appreciated about the discussion today was that it was not just about the act of giving birth, and how women die in childbirth. It was about prenatal care. It was about postnatal care or postpartum care. It was about the economic implications. It was about healthcare as a whole. There were so many different aspects of it that it was covered that I feel like when we talk about pregnancy, there's so many parts before, after, during that really, really, really don't get addressed enough. And I think that, there are people, as cruel as it may be, who may not necessarily think too much about women dying during childbirth, but whether that's a personal concern of yours or not, because you've had a child already or you're going to plan on having a child, I think that things like parental leave or postpartum coverage or mental health support, those are things that would really affect every woman, right? And so let's go through a couple of things that were announced today. First of all, let's talk about the fact that the Build Back Better Act is the overarching legislation that will go far in actually addressing addressing this crisis of maternal health. That has $3 billion of an investment. That's a historic amount. It's passed in the Congress. Vice President Kamala Harris says her and President Joe Biden are confident this is going to pass in the Senate. I hope so, because we really, really need this bill. Okay, so a couple of things. I'm going to give you receipts on this stuff, all right? Nelson says, how can we get the Bluetooth headpiece writer fired for? They're not going to get fired. I'm sure it was very profitable, because unfortunately, posting bullshit gets more clicks. That's why every single day, child, we see some bullshit about Vice President Kamala Harris, because when they see her name being invoked, it's going to draw attention to it. So they're not going nowhere. That's all we can do is just drag the shit out of them and push back hard. And what more important than dragging the people, we have to spread the message about the affirmative things that are happening. Because what somebody will say, I bet you can go on Instagram right now, go on any comment on any fucking post about Vice President Kamala Harris, and it's gonna be somebody saying she ain't done nothing. Where is she at? She ain't been nowhere. We ain't seen her. Wrong. Right. So that's where we can sit up here and help amplify the amazing work. And these are receipts. These are actual receipts. This isn't just rhetoric. These are receipts. All right. So Natalie says, I liked hearing the personal stories. It was heartbreaking. Yes. Focus on the before. Yes. Okay. And actually, let me just say too, having just given birth earlier this year, pregnancy is traumatic. And I don't like to necessarily put it in that harsh of terms, because it sounds almost ungrateful, and I'm eternally grateful for the fact that I had a relatively smooth pregnancy and I have an amazing, healthy, beautiful baby girl. But being a Black woman, there's a lot of extra anxiety knowing the Black maternal mortality rates, knowing the infant mortality rates. Also, I'm a little bit older, so there's all of this stuff that they scare the shit out of you about miscarriages and about stillbirth and about a whole other battery of things. And so it's a traumatizing experience. Even when everything goes well, I feel like I have post-traumatic stress from giving birth, and add on top of that, during a fucking pandemic. Natalie says, same. I gave birth in September. I was scared of being pregnant and of birthing. Congratulations. Now, I hope I'm saying that right, Natalie. Yes, it's scary. It's so scary. It's scary. You just worry the entire time. What's going to happen to my child? What's going to happen to me? And then your child gets here and then you're worrying again. And now he said the same thing. Mine went smooth, but oh my God, I was so scared. I was so scared, and I managed it, but it was an active process managing my anxiety the entire time. I had to actively manage it. It wasn't like, oh, I'm pregnant. Oh, ha ha. Like, it was more like every day I was trying to make sure I was in a basket case about, just my feelings and my anxieties. So I really appreciate this. I really appreciate it. And this is why I don't have no interest. People be like, are you sure you don't want a second kid? No, I don't want another kid, because the experience was amazing, and I only got to do it once. Okay. No shade to anybody who does it multiple times. I'm just not built with that level of anxiety to go through that again. Thank God I got through it. Me and my baby got through it safely. So this is incredibly important to me. And I remember actually before I got pregnant, I was on last year, 2020, Vice President Kamala Harris, she did some Zooms. She did like a smaller audience Zoom. It wasn't advertised. I didn't publicize anything about it. But, she gave advice. I asked a question about, what should women be doing right now, particularly in the pandemic? And I took that advice. She said, advocate for yourself. Don't be afraid to advocate for yourself. And throughout my pregnancy, actually, she called, Vice President Kamala Harris, then Senator, called and checked on me, made sure that I was good. She called me when I had delivered. She checks on Ava. She was incredibly, exceedingly gracious and just really wonderful towards me. And she didn't have to do that. You know what I'm saying? She just did it just out of the kindness of her own heart. That's how much she cares. She really, really, really cares about Black maternal mortality. She cares about motherhood, mothers, and people. And so I'm through that, but I also am still in the process of having a new baby. And so I understand a lot of these issues that she's addressing. I'm fortunate because I do have amazing healthcare. I practically didn't have to pay anything out of pocket. I mean, a couple $100s, but it was the average cost for families is over $8,000. I probably at most I may have paid $1,200 for everything for me and my daughter, and that includes our hospital stay, everything. I practically paid nothing going up until the hospital, except for I did go to the ER twice. And that was to be abundantly cautious. Nothing was actually wrong, thank God. But I got a $100 bill, right? So that is not a typical like situation. I was incredibly blessed with the kind of insurance that I have. But a lot of these issues, I understand the concerns. So anyways, let me get back to this fact sheet. And you can go to whitehouse.gov and you can look at this fact sheet if you want to get information. And you know what? Everybody has different things that are important to them. So there might be something here that resonates with you and you're like, oh yeah, I want to make sure that I highlight that. So we already said $3 billion of investment in maternal health. So another thing that this does is CMS. And I have to figure out what a CMS, because they use CMS quite a few times in here. And I should know this. I know. Oh, Centers for Medicaid and Medicaid Services. Okay, so that's what Chiquita Brooks LaShore is over, right? So CMS is releasing new guidance to help states provide 12 months of continuous postpartum coverage through their Medicaid programs. Apparently, that's not always happening because right now it's only 60 days. So this is something that is immediate, right? That's not like, okay, the Build Back Better Act has to pass. It's something that the executive power is within their power to do. So they're expanding, they're helping them expand the coverage postpartum from 60 days to 12 months. 60 days ain't really nothing. I mean, that don't even get you to your 6-week checkup with 60 days. Basically you're at the hospital and your stitches might not even be out if you had a damn C-section in 60 days. Okay. So that really ain't shit. So 12 months, that makes a big difference. And the reason for this is that, research shows that many deaths and complications occur more than 60 days following delivery. And this easier pathway for states was established by the American Rescue Plan and will become available in April 2022. So states including Virginia, New Jersey, Illinois have already extended postpartum coverage. That's the beauty of having a blue state governor, but Democratic governor for families in their states. And CMS is encouraging all states to take up this new option. So the American Rescue Plan that passed gave this authority. So that's really amazing, life-saving changes. The HHS Office of Assistant Secretary of Planning and Evaluation is releasing a new report showing the dramatic impact of state extensions of Medicaid postpartum coverage to 12 months. If every state adopted this extension, then that would extend coverage for 720,000 people a year. That would double the number of Americans getting coverage for a full year postpartum, okay? Create a new designation of quality maternal health services for our nation's hospitals. So this is a good one. CMS is planning to propose the establishment of birthing-friendly hospital designation. So this will be the first ever hospital quality designation by HHS specifically focused on maternity care. This designation is intended to be awarded to those hospitals that participate in a collaborative program aimed at improving maternal outcomes and implement patient safety practices, and it would add the designation to their Care Compare website to allow consumers to choose hospitals that have implemented best practices. That's really amazing, because here's the thing. Unless you have like a Kaiser or some kind of HMO, for me, I went with an OBGYN practice, and I had the ability to pick which hospital I would deliver at. And so there were 3 hospitals that this particular OBGYN office delivered at, and there was not information like this that was available. I would have loved to have seen, well, this hospital has this designation and that hospital doesn't, or all of them have the designation, so all of them are good. So this is really, really great information. It also, it's not just a designation, but it actually forces people to have additional requirements to go through. CMARA says our private companies, and thank you, by the way, CMARA, for that donation, compensated through the program for reserving employment for the mother. That would be interesting. Okay, that would be interesting. I don't know that answer yet, but maybe we'll find out together. I know that you're not. I mean, I'm pretty sure that right now it's illegal to fire a mother because she had a baby, but I could be wrong. That could be an assumption of mine. Let me take a breath. Hold up, y'all. Okay, so um, went too far. So I remember there was this big hubbub about, going back to the She the People thing, and there was a proposal that was more so focused on penalizing hospitals. I like that this one is a more affirmative one because not everybody has the ability to, there aren't a lot of hospital options available for everybody. And so taking funding away from a hospital could actually have a more adverse impact than it is than forcing hospitals to go through additional certifications and things of that nature. Anyway, so what else is in here? Um, so once passed, so let's say that we get this Build Back Better Act passed finally. If Joe Manchin and Chris Sinema get their shit together, and Chuck Schumer, because he's a leader, he should be doing something about this. It will have $3 billion in new maternal health funding, with new investments in growing and diversifying the perinatal workforce, improving data collection and maternal health risk monitoring. That would be great. Addressing the social factors that contribute to poor maternal health outcomes, addressing substance abuse disorders that impact maternal health, promoting increased maternal health research, improving postpartum coverage, and better coordinating care. We already talked about the expanding the coverage for postpartum. Spark innovation by allowing states to establish maternal health homes to better coordinate health care for individuals. Another big thing that Vice President Kamala Harris has emphasized is doulas and midwives. That was part of her Maternal Care Act, which was funding this pilot program in North Carolina, or kind of take this North Carolina program national, that successfully closed the racial disparities between Black women and white women. And so I'm sure that's in here somewhere. It's not called out in this particular fact sheet, but I'm sure that's in there somewhere. Natalie, thank you so much. Natalie, the VP mentioned a focus on fibroids. I can't remember the exact wording specifics. Yes. Thank you for mentioning that, Natalie. So, last year, Vice President Kamala Harris, along with, let me not get this wrong, Yvette Clarke, um, uh, introduced the bill, bicameral legislation, to actually fund fibroids research. And that was, let's see, let me get it up. I'm sorry. I should have had this available, but I'm not getting paid for this, y'all. So if it's a little unprofessional, it's okay. It's free professional. How about that? And so let's see. Yes, let's go here. A couple of things about that. It will provide $30 million annually to the National Institutes of Health, and to expand research on uterine fibroids. There's also legislation right now. This has been reintroduced in Congress. It would also allocate money to the CDC to fund public education campaign, which is really important. Direct the CMMS to grow its chronic conditions database to include more information on services for these patients. So here's the thing. This is what's absolutely crazy. So there are 26 million women who have fibroids, but this disproportionately impacts Black women, with more than 80% diagnosed, and that's just diagnosed. Who knows how many people go undiagnosed with the condition during their lifetime. 8 out of 10 Black women will experience fibroids, and Black women encounter symptoms earlier than white women do, and they're more likely to undergo hysterectomies as a course of treatment. And I also want to point out that doctors are much more likely to suggest hysterectomies to Black women. I don't know a Black woman that does not know somebody or is not themselves impacted by fibroids. I can name several people. And fibroids are a reproductive health issue because, again, hysterectomies. You also have women who, are given a shorter time frame to have kids. After a surgery, they say they have a certain and they have a certain number of years, or they're encouraged to have babies in a certain amount of time. It can also make women more likely to miscarry. So these are very serious issues. Also, you have heavier periods or things like that. So there are a lot of real important issues, and this is something that Vice President Kamala Harris mentioned today. Thank you, Natalie, again, in her opening remarks. So that's another area of focus. So that's why I said, well, this is so important, because it's really taken a much broader view of maternal health than just a woman making it out of a childbirthing scenario, or a birthing parent making it out of a childbirthing scenario alive. Natalie says, almost all my Black women friends have fibroids. And the 33 says, Tiffany Cross talked about it on her show. She started losing her hair. Exactly. So this is a serious, serious issue, because I want to give the folks who have introduced this again their props. So this was introduced in 2020, didn't pass, unfortunately. But it has been reintroduced again. It's the Uterine Fibroids Research Act. So this has been introduced by Congresswoman Yvette Clarke once again. And it's I clicked off it. It's called the Stephanie Tubb Jones Uterine Fibroid Research and Education Act of 2021. So this has been introduced again, also led by Congresswoman Robin Kelly, Bonnie Watson Coleman, and Congressman David Scott of Georgia. So this is an incredibly important bill. It needs to pass. I feel like I saw somebody in the Senate had introduced it. Okay, here we go. This is actually Cory Booker and Shelley Moore Capito, actually a Republican. Can you believe that? They both introduced this legislation in the Senate. And this was introduced in July. I don't know what the status of it is, but this needs to damn pass. Okay. Yeah. So hopefully that does pass. But I know at a minimum that Vice President Kamala Harris is a champion on this issue, and she will do what she has to do to push this through. Natalie says, I wish knowing these numbers that Black women were screened for fibroids earlier. Yes. And Natalie says, I didn't know I had fibroids until I was pregnant. Yes. And so you had a smooth pregnancy, Natalie. Thank God. But yet you found out that you had fibroids during that pregnancy. So that's an additional layer of anxiety, right? And unfortunately, I mean, imagine if there was any other condition in this country that impacted 80% of any other group. But since it's 80% of one Black woman, we're still trying to get basic research done. So it's so important that Vice President Kamala Harris is drawing attention to this, that it's part of the advocacy and the work that they plan on doing as part of this Maternal Day of Action. Pam says, thank you, Risa, for highlighting how they Columbus Kamala on this back during the presidential election. Robin says, I've had surgery twice for it. Yes. I mean, this is something that really, 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 really impacts Black women. And, honestly, what I can say is one of the most, just one of the things that stops people in their track particularly Black people, because Black people have really been targeted with disinformation about Vice President Kamala Harris. But one of the things that stops people on their track is I pointed out that she introduced legislation as a senator to fund uterine fibroid research. Now, this is something that impacts 80% of Black women. And they're like, wait, what? I had fibroids. I know somebody who has fibroids. And so this is an issue that this is a Black woman's health issue. So it's 27 million, but Black women specifically really, really, really need something to be done about fibroids. So that's that. I just wanted to give you guys an overview of kind of what the administration is doing. But there's another important part about it that was also announced that I wanted to go into, because it kind of gives you an idea of the variety of steps that can be taken. One of the things that Vice President Kamala Harris has always been really exceptionally great at is forming private-public partnerships. So when she was district attorney of San Francisco, she formed private-public partnerships for her Back on Track program. She was literally, and I interviewed Latifah Simon, who who formed the program with Vice President, well, then District Attorney Kamala Harris. And she told me how Vice President Kamala Harris was going into her Rolodex, like personally calling people to get jobs for the men. These are Black and Latino men who were facing up to 20 years in prison for possession. 2 grams of crack can get you in jail for 20 years at that time. This is 2004 in San Francisco. So people like to act like San Francisco is so liberal and California is so liberal and Kamala Harris is locking people up for weed. That's not true. That's not true. She was actually getting people out of jail for weed. She wasn't even prosecuting people if all they were doing was simple possession. Okay. But the whole point of that is to say that it was through, this is a prime example of how she used private resources, how she tapped into private resources and got buy-in from them in order to enhance this program that she was on. I'll give you another example. There was a unaccompanied minor surge during the Obama-Biden administration. And one of the things that then Attorney General Kamala Harris did was she raised private financing, donations to pay for the attorneys for these unaccompanied minors. So she's done that. Even the whole truancy thing, which has been completely there's so much disinformation about that. She formed private-public partnerships on to address truancy. So this is a history of what she's been done. When you look at her work that she's done in the administration around the trying to attack the root cause of migration from this Northern Triangle, remember, she has a diplomatic mission. She's not on a horse, a cowboy at the border. That's not her job. She's not a border patrol person. She's not ICE commissioner or whatever the hell is person, chief, whatever. She's the vice president who's on a diplomatic mission. So anyway, one of the things that she has done with that is she's secured all of these private investments. I mean, I can go down a list of things that she has done to secure private investments in public partnerships, right? And so that hasn't changed. She's done it again with a call to action to reduce maternal mortality and morbidity. So I shared the screenshots, but I want to go through this because I was really struck by the variety of different acts that would be taken. Honestly, as passionate as I am about this, I would not have even had such a wide-ranging view on how to tackle this or all of the issues that could be used to address. Also, I wouldn't have even known about these different kinds of groups who experience things that I haven't experienced. So without further ado, let me go get into it. So this is also on whitehouse.gov. The Association of American Medical Colleges, the AAMC, is announcing that they will hold a maternal health incubator on May 24th to 25th, which will be 2 days virtual convening to better understand the data needed to effectively address maternal health inequities. They will identify and share evidence-based strategies to decrease racial and ethnic maternal gaps, and will develop an action plan aimed at eliminating inequities through local, state, and federal policy collaborations. Association of American Medical Colleges. So part of this is training and part of it is developing strategies. So that's really important to get them on board. You also have the American College of Obstetricians and Gynecologists, the ACOG, which is committing to leading efforts to increase COVID-19 vaccination rates among pregnant individuals, including forming a COVID-19 vaccine confidence champion network comprised of ACOG members that will facilitate peer-to-peer trainings to boost vaccine confidence. Child, because we ain't getting out of this whole, you got to take a vaccine situation. We got more fucking variants, people still vaccine hesitant, and pregnant women are actually one of the lowest groups of vaccinated people. Understandably, there is anxiety about it. And I don't think that the messaging has been very consistent and clear in instilling confidence from pregnant women into going to get vaccinated. And this is something that I've talked about on the various platforms I'm on Roland Martin, on Clay Kane, on my own platform, about how the vaccine has been proven safe for pregnant women. My sister's weeks away from having a baby. She's vaccinated. Her doctor recommended that she get a booster. I got vaccinated right after I had my baby girl. I'm a nursing mother. She's fine. Okay. I'm not spreading 5G through breast milk to her. So I think it's really important that we have OBGYNs really on board with educating and increasing pregnant women getting vaccinated. And then, of course, you have pregnant women who will need to get boosters because the mortality rates, the stillbirth rate for women who are giving birth while they're COVID infected but not vaccinated are just absolutely just tragic, really. So anyway, so what else? And they're going to launch a podcast series early in 2022 aimed at increasing vaccine confidence among pregnant individuals through a mix of clinical recommendations and storytelling. And I can tell you, if pregnant women don't do nothing else, we gonna research some shit. Okay, we gonna look for articles. We're gonna read stuff. We're gonna watch videos. We're gonna have conversations with our doctor. So it's really important to put a body of work out there. Michael, I agree with your comment. Okay. Blue Cross Blue Shield Association is announcing a national partnership with March of Dimes to advance health equity outcomes for moms and babies, titled Awareness to Action Dismantling Bias in Maternal and Infant Healthcare. Heavy on the infant because, Black babies, Black infants have a higher mortality rate if they are seen by a doctor who's not Black. That's sad. That's sad. That the act of not having a Black doctor makes Black babies more likely to die during care. That is unconscionable. And so we have to tackle this bias. And it may not be conscious bias, but conscious bias, subconscious bias, don't fucking matter, has the same result, which is more Black babies are dying in avoidable situations. So anyways, so it's through this partnership, BCBS companies will be able to offer March of Dimes implicit bias training to providers, nursing and medical students, perinatal quality collaboratives, community organizations, and their employees. The program has been initially rolled out in 20 states and will be expanded to additional locations in the coming year. So that's amazing. The Council of Large Public Housing Authorities, CLPHA, is announcing that they will hold a Martin Luther King Jr. Day event on January 18, 2022 to discuss how racial discrimination has jointly impacted housing inequities and maternal health outcomes. This is the area where I said, for me, my scope, I wouldn't have even thought about this, but it's important. Housing security is very important. I'm sure a lot of people experience housing insecurity during this pandemic. Common Spirit Health is announcing the expansion of a text-based patient navigation program with docent, through which patients have the option to be paired with virtual care navigators for personalized care and guidance to improve length of stay and preterm birth outcomes. Currently, the program operates in California and Arizona. Now pledges to expand the program to the Pacific Northwest, the South, East, and the Midwest. It's also launching a new set of protocols developed in partnership with the Morehouse School of Medicine to address hypertension disorders in pregnancy in several markets, starting in Tennessee, Washington, California, and Kentucky. Hypertension is a huge issue in pregnancy. It can cause you to go into preterm labor. It can have all kinds of implications. So I think that this emphasis on hypertension is really important. And several times hypertension is mentioned throughout these partnerships. And I also think that the text-basing thing could be good because one of the things, you might really like your OBGYN. My OB, she was cool, but I would have really liked to be able to kind of just quickly text instead of having a call hotline. You get an operator, then you explain to them, and then your OB calls you back later. Or if you call the office and you got to deal with receptionists who got bad fucking attitudes, you know what I'm saying? Nobody want to deal with that shit. And so you just be like, you know what? I'm not even going to call unless it's an extreme situation. I would much rather have a situation where somebody was accessible through text. Then that way, if I had concerns, if I had anything, then I can easily address it with them instead of maybe save myself a trip to the hospital or, other anxiety. So I love that idea. CVS is investing nearly $1.8 million in new maternal health initiatives. These include partnership with Every Mother Counts, an investment of over $600,000 to launch the Choices in Childbirth video series. Choices in Childbirth is a series of on-demand videos and supporting resources aimed at assisting parents through their maternity care journey, with the ultimate goal of improving maternal health and birth equity in the United States. Becomes January 2022. So that's really important. multi-year partnership of $250,000 with the National Association of Free and Charitable Clinics, through which 9 clinics will receive additional education and clinical training for providers to help identify patients at risk for preeclampsia. That's a huge thing that impacts a lot of women. In addition to providing philanthropic foundation dollars, CVS is donating low-dose aspirins for patients at those clinics. Okay, investment of over $800,000 in American Essential Hospitals (AEH) to address maternal mortality and morbidity across 12 hospitals who have outcomes above the national average, especially for Black patients, with a focus on hemorrhage or hypertension. Woo! Okay, hemorrhaging, the blood loss, that is a huge, huge, huge issue in terms of maternal mortality. And I appreciate the fact that they already have 12 specific hospitals identified, and they're going right to those hospitals to improve the outcomes there. And it particularly impacts Black patients. This is not a theoretical thing. This isn't some, oh, we're going to put out a class and hopefully maybe we'll see everybody has an option of attending it. They're actually addressing specific hospitals that are experiencing higher mortality rates. So that is so incredibly important. The funds will support the expansion or enhancement of locally tailored initiatives, identify elements of care, improving obstetric, sorry if I'm fucking that up, care for Black pregnant individuals, and disseminate the lessons learned to over 300 members of the AEH network. Okay. That's going to launch in January 2022. DoorDash. Did you guys know anything about this? Through a partnership with CARE and the Homeless Prenatal Program, has delivered thousands of boxes containing foods and essential items to unhoused and unstably housed pregnant mothers. DoorDash has committed to expand this program to 7 more people. Not 7, to serve more people in 2022 by continuing to donate all deliveries through its partnership with CARE. Wow, it's unfathomable to me. For me personally, not in the universe, but for me personally, to just imagine just being insecurely housed or unhoused, unstably housed. And so this is where I meant earlier, like, it's really hitting on so many different facets of mothers or birthing parents and different issues that arise in society, where we don't talk about unhoused mothers. We don't talk about unstable housed mothers. And certainly we don't talk about them as a society in ways that's actually empathetic and saying, how do we help these women? It's more so wagging the fingers at them and how dare you, and handouts and entitlements and blah, blah, blah. So that's really awesome of DoorDash to have that program. Every Mother Counts. EMC commits to launching the EMC Transformation Fund, designed to seed, incubate, and accelerate early stage ideas on maternal care. They will commit $5 million over the next 3 years to provide funding for these initiatives. Families USA is going to extend their efforts to improve maternal health into 3 new states with a specific focus in equity. It's going to, so this one is actually going to expand home visiting services, doulas, and community health workers. So this was something that worked in North Carolina with the home visiting services and doulas in closing the gap between Black mothers and white mothers in terms of their mortality. So I'm really excited to see that one. GE Healthcare is going to extend its clinical decision support software to 300 hospitals, which will help clinicians make decision-making for over 1 million women and children during labor and delivery across the United States. And so this is important because, one of the things that feeds into maternal mortality and infant mortality is believing women, right? Believing mothers, particularly Black women. And so, the decision tree hopefully will take into account these implicit biases that are detrimental. But it sounds good. Whether it does it or not, I don't know. We'll see. Happy Family Organics will donate an estimate of $1 million in free expert consultation services in 2022 to improve maternal and postpartum health outcomes for women. They currently support one-on-one expert support to women and infants through virtual platforms staffed by registered dietitian, nutritionists, lactation consultants, and mental health professionals. And they will launch this initiative to include prenatal and postnatal nutrition guides, meal plans, articles, and recipes. All good stuff. Kaiser expands the remote care monitoring programs for hypertension. Another time mentioning hypertension. to all its members by mid 2022. And they will evaluate this program and its effect on health outcomes by race and ethnicity, with preliminary research findings by early to 2023. Lyft, in partnership with CareSource, will conduct analysis on the impact of safe, reliable transportation has on healthy pregnancies. This is where infrastructure comes in. This is where ride share and all kind of stuff. So this company will measure the effects of access to rides they provide to healthcare appointments and other maternity-related services, such as to grocery stores, pharmacies, and educational classes. And they will publish a report on this initiative to after data collection efforts in several states. And Lyft, y'all need to come up with some coins too. Okay, give some people some free rides. How about that? But a study is nice. We need data, right? Mm-hmm. Maven Clinic will expand its free education and advocacy initiative addressing vaccine hesitancy for pregnant women, enabling. What in the world? Something just came in over my thing. I don't know if this is something, child. What was that? That was weird. But anyway, that's why Bluetooth is more secure. I mean, sorry, not Bluetooth. That's why wired is more secure, because if this shit's coming in my headset, I can only imagine what the fuck's happening with Bluetooth. Okay. Anyways, so let's see. Vaccine hesitancy. That's what the Maven is doing. Maternal. I'm almost to the end, y'all. This is a lot of shit. Damn, I'm not almost to the end. Okay, I'm gonna make this even quicker, child. Let me see. Maternal health care partnership between March Dimes. They are going to capture self-reported experiences of racism and discrimination during pregnancy and generate data-driven insights. So that will provide actionable feedback to hospitals and health. You know what? I can kind of see why people write these bullshit stories, because this is a lot of work to write up articles on actual substantive stuff. Nobody wants to educate on all this shit because it doesn't fit in the meme and doesn't fit in the clickbait headline. But this is actual life-changing stuff. So I'm going to continue, because if I don't do it, child, who the fuck gonna do it? All right. Let's see. Merck has pledged to expand its Merck for Mothers program by $150 million globally in 2021, with the goal of improving maternal health and well-being of 25 million women by 2025. $15 million in new funding will be devoted specifically to address racial disparities and maternal health in the United States, with the intent of building on the Safer Childbirth Cities initiative and scaling community-led programs to eliminate racial health disparities. Woo! That's some real shit. That's deep. That is real deep. Okay. National Perinatal Information Center, NPIC, is going to partner with 15 hospitals, public and private partners, and other maternal health organizations to elevate the need for accurate race and ethnicity reporting within electronic health records beginning in 2022. This commitment will impact data analysis and stratification for over 725,000 mothers and newborns. Yes. All right. And we're going to be able to see from this the maternal neonatal outcomes stratified by race and ethnicity. That's important. The New York Fed, because a lot of times people try to make it seem like, oh, you imagining shit, or oh, you're pulling the race card, or you're making it a racial thing. It is a motherfucking racial thing. What y'all talking about? It is not a healthcare access thing alone. Allison Felix today talked about how she has really great healthcare, and yet she still experienced, the issues that Black women across socioeconomic lines experience in terms of childbirth. Same thing with Serena Williams, one of the most elite athletes in the world. And she experienced racial discrimination during childbirth. So it's not just something that's simply solved by Medicare for all, for instance, or, people that don't have insurance and, well, what do you expect? Blah, 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 blah. No, it's women of all different backgrounds that are experiencing this. Anyways, the New York Fed, in partnership with NYU's Rory Myers College of Nursing, is going to identify scalable solutions to improve outcomes in maternal and child health. Okay. There's more there. Pampers will double its accredited implicit bias training for maternal health care staff in high-need states of 2021. This will impact over 20,000 birthing parents each year. Philips is announcing a new expanded research programs in virtual care and artificial intelligence to help close the gap on maternal care deserts. So that's an issue. So if you have maternal care deserts, one of the ways of addressing that, and so you can get hospitals built is through virtual care. So this is really important. And it's going to begin working with health systems on pilot programs that will expand remote fetal monitoring, further supporting expectant mothers in maternal care deserts. Institute for Perinatal Quality Improvements, PQI, is launching a Speak Up Against Racism faculty course. The Speak Up program is a quality improvement approach that supports individuals and teams to improve and eliminate inequities in structures and processes that contribute to disparities in perinatal outcomes. So it's going to be a faculty course. That's important. Sage Therapeutics has committed to expanding its Check on Mom program. It's a maternal mental health pilot initiative that provides information and resources to help women prepare for the fourth trimester, which is a 12-week period after giving birth, and intends to scale this program from 250 moms to 250,000 moms with postpartum depression, including those in communities most at risk with postpartum depression. And Uber, last thing, Uber is announcing that it will publish the results from their Rides for Moms initiative program, a program launched with Surgo Ventures, Community of Hope, and Mary Center to provide free transportation for prenatal and postnatal care appointments for up to 1,000 pregnant people in the Washington, D.C. area at the program closed at the end of 2021. Uber will publish a report with their findings from this partnership that will inform future initiatives and help improve maternal health access. Woo! Okay, y'all. Woo, I might need some tea, some chamomile or something after that, because that was a mouthful. But that's the reason why I wanted to do this, because I don't know if we're going to get a comprehensive look at it elsewhere. Something in there somewhere has probably resonated with people, whether it's your personal experience. It could be postpartum depression, it could be postpartum health coverage, it could be housing instability, it could be needing transportation, it could be a number of things. It covers so much. There's still more work to do, but I feel really, really good about the fact that the work is actually being done. And so when I say now Black maternal mortality is an issue, now I can really expand that universe of what's being done. And all of us got here from somebody pushing us out their legs or being ripped out their stomach. My baby came out my stomach, child, C-section. So this should be something that everybody should be invested in, everybody should care about. And so feel free to share it. If you can share a clip of, VP's speech. There were a lot of speeches today. Share articles. We have to get this word out there. Talk to your friends. Talk to your family about it. One of the things that I think I struggle with in terms of the way that Vice President Kamala Harris needs to be more ingrained in our conversations is that it's always the bullshit and the nitpicky stuff, that really insidious pointless shit that's always trying to make her feel incompetent or look incompetent, and yet the substantive stuff is not even getting any kind of attention. And this is the stuff that actually matters, not that she uses a wired headphone instead of Bluetooth. The fact that she's really, really getting $160 million, I added it up, in investments in maternal health from the private side, on top of the $3 billion of money that's in the Build Back Better Act. And I know that she has personally fought for keeping the investments in maternal health in the Build Back Better Act. I know that. So we have to really, 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 emphasize this kind of stuff. And there's a lot of substantive things that she's up to, but talk about fibroids, Black women especially, talk about fibroids, and let's talk about maternal health. So that's all I got. I didn't intend to be on here for an hour and 30 minutes, but thank you all for tuning in. Thank you all for contributing. And it's not, you don't have to share this video, and actually you probably won't get far if you share this video, but I hope that you all learned enough to where you can talk about it and share other things that are more succinct than this very comprehensive thing that I just went through. So you all have a good night, and I will check y'all next time. Bye.